What I'm going to do is I'm going to go right above the scapula. I'm going to pick up and tent the skin. When I'm tenting the skin, I'm going to take my thumb and place it right at the base of the skin. So I can part and see where I'm going to insert my needle. I'm going to take my needle, bevel up, and I am not going to use alcohol before I insert the needle. Generally, alcohol is not necessary for subcutaneous or intramuscular injections. I'm going to have my needle at a 45-degree angle. I'm going to insert it to the base of the needle. I'm going to aspirate to look for that negative pressure. So you see I draw back on my plunger, and you can see that it has negative pressure because it's trying to pull back that plunger. And then I'm going to gently administer the medication and withdraw my needle. Today for this demonstration, we're going to use the left epaxial muscle. When palpating for your injection, you're going to want to take your thumb and cover it over and palpate the dorsal processes of the spine. With my middle finger, I am going to locate the wing of the ilium, and then with my index finger, go right in the middle, and I can feel a bit of a bouncy motion, and that's the epaxial muscle. Once I have those landmarks located, I'm going to gently just go just cranial to that, palpating that muscle, and where my index finger is where I'm going to insert the needle. I have my labeled medication, and I have my bevel up as I'm inserting the needle. And I'm going to insert it at a 45 to 90-degree angle. I'm going to insert the needle to the hub of the needle, and then I'm going to aspirate. And note that there is negative pressure in that syringe, and now I will advance the plunger and remove my needle. I want to make sure I have all my supplies necessary before I start. I have my clippers to clip the area, I have my medication, and then I have my isopropyl alcohol. This injection is going to be into the saphenous vein. Now I'm going to ask my restrainer to occlude. If you can see, the vein is just running alongside here. I will now add some alcohol, which acts to help disinfect it. Sometimes if you don't see the vein right away, you can always gently squeeze the distal end of their paw to help that vein show up. I have my right hand holding my patient's limb. I have my needle that is having the bevel up and just a little bit more than parallel to the vein. I'm going to insert my needle, aspirate, wait for that flash of blood, ask my restrainer to stop occluding, and I'm going to slowly inject the medication. I'm going to ask my restrainer to put their thumb over the insertion site, and I will gently remove my needle.